Hello everyone, I'm Binila, faculty from the Medical ICU. I'm here to share our team's COVID experience and struggles this year. COVID season 2, that's what we call it. When I look back at the past year, I realize that what we faced then was nothing compared to what is happening now. All of us in the department were just beginning to relax and feel really good, and then the second wave came. And my, it definitely wasn't a wave. The first wave seemed like just a tide in comparison to the tsunami of cases that hit the ICU and the waiting list of patients who were supposed to get into the ICU. In some ways, I'm glad the first wave happened the way it did and was nothing like what we are facing now. It allowed us to get a feel of the disease and fine tune our protocols. This year truly feels like a war zone. The tsunami of cases is overwhelming, with patients and their relatives pleading for an ICU bed. Frantic calls day and night to get care, medicines, oxygen, medical advice. We have to make tough decisions sometimes. Triage our patients. God forbid we make a wrong decision. Our daily video calls with the relatives, another difficult experience. Normally, pre COVID, family discussions would involve the key decision makers in the family. We wouldn't see the children at all. Here, one can see the kids during the video calls, hovering in the background, keen to see their loved ones. Some of them even plead with us to save their parent. Some have become mature beyond their years and encourage their mom or dad that they would get better. This year, unlike last year, we've had to intubate a large number of patients. Explaining to families what it meant and its consequences and helping them understand that the outcomes are uncertain is heartbreaking sometimes. We allow families to have a video conversation before intubation. Both of us, relatives, and the medical team, know that they may not be able to communicate with each other again. We've seen brokenness, happiness, helplessness, anger, fear on both sides, the families and the healthcare workers. Some people have asked, how do you go on increasing ICU beds? What keeps you going? Well, I kind of put myself in the patient's shoes, those who are waiting for an ICU bed. I know that we will never be able to match the need, but there is a motivation to help as many as possible. Were we scared? Are we scared now? I am not, and I know most of my team isn't. God has been so good, and the confidence He has instilled is mind boggling. We need to take care of these patients. We are placed in this position to do this and to show the patients the love and care that their loved ones would have given. Do I get burnt out? Occasionally, I do get exhausted mentally. It's really not easy to maintain one's passion as we keep hearing depressing news. This year has been crazy busy, but it has been a year of learning on how to deal with these crisis situations. It's been hectic with us opening and expanding our critical care services. A year of opening new ICU areas, getting the necessary equipment quickly, getting the staff ready to face every scenario. Gone to the wind were our rosters. Every week it would change as new ICU pods opened up. In fact, many of our registrars say they've stopped looking at the rosters due to the multiple changes, not just due to new ICU services opening up, but also due to staff being quarantined or becoming ill. We're very grateful to God for having protected our entire staff. Everyone's been kept safe, and very few people had mild COVID illness. I'm very grateful to the entire ICU team, housekeeping staff, attenders, therapists, nurses, doctors. Everyone has been so passionate about their work. They've given of themselves selflessly. They haven't complained, even though they haven't had a break. Thank you all. Stay safe and God bless.